ZEO was founded by a local society of GPs that not just wanted to discuss about the vision and future of primary healthcare, but actually put it into business. So they founded ZEO as a business for them to introduce new business models in primary healthcare. And we're providing that in 3 different levels. First of all, we represent GPs. We got 90 GPs, 150 physiotherapists and 30 dietitians. And if the City Council wants to speak to the GP, they speak through us, and we provide them with one vision on the future. And the secondary product is that we provide disease management programs for diabetes, asthma, cardiovascular risk management, frail elderly, anxiety and depression. And what we do is we design a protocol for the entire care, for instance, for a diabetic patient, not just GP, but entire system, excluding hospital admissions. And then we determine which healthcare provider has which role, how many times should one see a nurse or a doctor, what time is involved, and eventually there comes a summative price that we offer to healthcare insurers. So the healthcare insurer has a contract with us for the diabetes patient care for 1 year, and we make sure that GP and the specialist and the nurses are doing everything accordingly. And thirdly, we're providing all sorts of facilitatory products to those primary care physicians. Ranging from central purchasing, IT, real estate development, to quality certification and continuing medical education. So it's a big range. Basically everything normally a hospital provides for specialists, we provide for GPs and physiotherapists. Well, what we've achieved is that on different levels, what we've demonstrated to GPs, that relinquishing a bit of your own autonomy provides more than you lost. They do feel, after all these years, looking back, that health care has improved for their patients, for themselves. A lot of the GPs are doctors primarily and entrepreneurs, not by choice. And especially the new generation, which is 70% female, working part-time, are very comfortable with a business they can rely on, ZEO, to provide them with all sorts of products. So that's a big achievement. What we also saw is that we had a very divided healthcare system as into costing, where the GP got a different reimbursement than the specialist and the physiotherapist. And these programs have limited the barriers of funding, and you do see that these healthcare professionals are working much closer together than they did in the past, and research shows that the patient outcomes eventually do get better when professionals are working together without any financial perverted drives that we had in the past. And thirdly, I think that we are more and more contributing to the regional but also the national debate on the future of healthcare. The GPs are very pivotal. They are the gatekeeper in the Dutch healthcare system. But because of the diversity and because they were so fragmented, they were never really a proper partner to discuss with. And nowadays, City Council, for instance, is very glad to discuss all sorts of healthcare issues with us, because they got one portal in which to address primary care. So I think that those are the 3 big advantages that we've achieved. We're quite ambitious, and what we set out to do, and we're about to be appointed as a national pilot area by the Minister of Health, is to go into a project that's called population-based costing, where we are one of the initiators, together with a healthcare insurance company and a patient organization, that we say it's not just primary healthcare that we need to redesign, we need to redesign actually the total system. Looking in clinical pathways, collaboration systems between GPs and specialists, how do we prescribe pharmaceuticals, and whether or not that's evidence-based, etc. But also addressing the attitude of healthcare providers and patients, where healthcare providers earn more and more because they're all paid fee-for-service with exceeding budgets, and patients are brought up with the idea that healthcare is limitless and endless and 24 hours a day, and we can no longer afford that. So population-based costing basically is that you create a virtual regional budget and you say, this is the pie, that's what we're going to have to divide, and it's not the government, it's not the healthcare insurer, it's our own responsibility. We are accountable for containing costs and still providing good quality of care. So we're now dealing with a whole new range of discussions between primary care and hospital care, for instance, where it's not so much we're going to do what you used to do, but rather how can we together redesign healthcare pathways so that we provide more care per euro and a better outcome. And that's going to be a massive challenge, because inevitably some of the healthcare providers will have a shrinkage of their budget because they've been growing and growing steadily. So now we're going to say, well, no more. That's not going to be easy, but being a national pilot, we hope that that framework entices people to make that step.